let's go to you now, if you can. I don't know if you could hear that. Of course, you work as a practicing nurse alongside being an MP. You did care for patients during the pandemic. You were absolutely on that front line. There's no doubt it was harrowing to watch for everybody, harrowing to live for you and your colleagues. One of the things, though, that that concerns us is the emergence of the fact that some of the problems, some of the not being believed by key workers on the front line, and indeed not having proper PPE, is still a problem.
Yeah, I mean, I was on the front line. I had to get special permission at the time because I was a whip from the Cabinet Secretary and the Prime Minister to go and take what's called a second job, to go back to the front line on the COVID wards. And I've been a nurse for over 25 years before I became an MP. And I can honestly say, hand on heart, I have not experienced anything like that. And my frustration, my job now as Vaccines Minister is many people dismiss what happened. They say people weren't that ill. COVID was, hyped up. It absolutely wasn't. I saw firsthand patients, who could not see loved ones, who really did need a lot of support. We had no idea at that time a vaccine was coming. We had no idea how long this was going to last for. We had colleagues that were sick. I know colleagues who died as a result of COVID. They were just some of the most traumatic shifts I've ever had as a nurse. And so I absolutely respect all staff who took risks themselves to help care for patients at that time.
One of the important things, of course, that we're trying to understand now is how we can learn lessons from what has happened. The drama that was on for the last few days, and I'm sure you've watched it or you know firsthand what it was like anyway, was based on the Dr Rachel Clarke and the book that she wrote about her experience. We had her in the studio yesterday talking about the scenario. I just want to play you a clip of what she said, because she's really concerned that actually the government hasn't learned enough and it needs to sort a few things out. This is what she said.
Not only did we not have PPE at the time, we don't even have proper PPE now. If I go to see a COVID patient, I still don't get a proper FFP3 protective mask. I get a flimsy paper mask. Not only is the government still unprepared for a next pandemic, they're still failing staff now.
What do you say to that?
Well, I am disappointed to hear that, because we've got stockpiles of PPE, FFP masks, gloves, aprons of the right standard, particularly as we're living with COVID. COVID hasn't gone away, and so we are ready, should a variant of concern emerge, that we can step up distribution of those. I would personally like to see speak to the trust that Rachel is working for, to see why that's not available on the ground, because we have the stockpiles.
Could you go and do that and then come back to us, because I think that's really important.
Yeah,
because
but also, Kate, one of my frustrations with the COVID inquiry at the moment is I'm the pandemic preparedness minister, and I want to learn the lessons. Should we have done better? And the inquiry at the moment isn't really pushing those boundaries about lockdown, about face masks, about vaccine rollout. We really do need to learn those lessons so that we are ready, whether it's for COVID or for another pandemic in the future.
Can I just ask then, from your first-hand experience, and you were on those wards, you did a number of shifts, and obviously you're part of the government now, you can talk to these ministers. What would you say were the key things that you saw and you experienced that the government must learn from? Is it predominantly the lack of PPE?
PPE was an issue, although in my hospital we did get PPE rolled out fairly quickly. We're a small hospital, so it's easier to distribute. But also, it's just recognising those warning signs earlier. We are constantly with UK HSA now, which weren't in existence at the early stages of COVID, constantly monitoring threats, because PPE is different. PPE for a flu pandemic is different to the PPE you give for COVID or for a different virus. So you can't always use the same equipment. So just stockpiling stuff isn't enough. Constantly monitoring. So, for example, avian flu isn't a threat to humans at the moment, but we're constantly monitoring that should that change and it's, humans are picking it up and becoming unwell for it, that we can react nimbly to that and get a vaccine, get the right protective equipment available for it. So it's about being more alert to the threats that are emerging. Measles, for example, we've acted pretty quickly when we've seen an outbreak in the West Midlands and London and getting those unvaccinated children vaccinated. It's about being a bit more nimble to the threats that were emerging. We can't just assume that the tools we used last time will work for any future emerging threats.
And listening to the people who are telling you as well on the front line, whatever the challenge is, it's got to be something that we take forward. Something we've been hearing and hearing from our viewers is this new guidance on menopause, that the idea that if you have the menopause, it should, in a sense, be looked at almost like a disability. And indeed, employers insisted to actually give people I think it's reasonable accommodation is the phrase. How do you define that? You might be able to answer. But is this something that you would support?
Well, currently, the commission that have produced this report are not recommending changing the Equality Act, which is what underpins all of this, that if you're discriminated against certain protected characteristics of for menopausal women, that could be based on sex, age or disability, that they are existing laws that women can use to take employers to tribunal and take action against. What we're trying to do with my menopause, I'm the chair of the Menopause Task Force, is to really try and change the workplace culture in the first place, because we're losing about 1 in 10 women who are menopausal in the workplace. These are our most experienced women. And when you talk to the vast majority of employers, they want to keep women in the workplace, but they just don't know how to. And so we are offering training and support. We've got a menopause employment champion now, and simple things like good ventilation, time off to go and see the GP, even the uniform you wear, if it's made of a certain material, will make it much harder if you're going through the menopause to be able to stay in the workplace and cope with those symptoms. So the vast majority of employers are doing the right thing. The existing law is there to protect women who may be being discriminated against, and should be addressing that with their employers if that is something that's happening to them.
Can we just briefly talk about as well the reason that you wanted to come on today to announce this certificate that can be granted if a couple loses a baby or someone loses a baby before 24 weeks of pregnancy, which up till now hasn't been available to them. I think it's a really important step for any parent who has been through the loss of a child before 24 weeks.
Yeah, no, absolutely. And it's part of our wider pregnancy loss work that we're doing. We're trying to reduce the number of babies lost in the first place. And we've seen a 25% reduction in stillbirths and a 30% reduction in neonatal deaths. But babies, unfortunately, will die in some circumstances. And up until now, parents who lose a baby before 24 weeks could not register that birth, could not get a certificate to acknowledge their baby. And so from today, parents will be able to go on to the .gov.uk website. They'll be able to register their baby, their name, their date of birth, the date that they were lost, and will get an official certificate in recognition of that baby. Just to say, it's just going from 2018 onwards at the moment because we want to make sure the system's got capacity, but we will move that so that all parents, because I've met mums in their 70s who still are struggling with that loss, will be able to retrospectively register their baby.
OK. Well, look, Maria Caulfield, thank you very much for joining us this morning. I do appreciate your time.